Hello friends, in this video we shall look at the anatomy of uterus. Uterus is a secondary sex organ. Secondary sex organs are components of reproductive tract. They mature during puberty under the influence of sex hormone. The sex hormones are produced by primary sex organ. Primary sex organ in males are testes and in females are ovaries. Secondary sex organs are responsible for maintenance and transportation of gametes. In this section, we shall look at the composition and clinical significance of uterus. This is the overview of female reproductive tract. Female reproductive tract or system consists of fallopian tube, they are paired structures, ovaries, they are also paired, and the single structure or unpaired structures like uterus, cervix, and vagina. Shape and size of uterus. The uterus is pear-shaped. About its size, the weight is 30 to 40 gram, thickness 1 inch, breadth 2 inch, and length 3 inch. About its gross anatomical structure. The uterus is divided into two main parts, the body and the cervix. Body is the larger upper pear-shaped part and the cervix is the small lower cylindrical part. The body forms upper 2/3 of uterus and the cervix forms lower 1/3 of uterus. The junction between the body and cervix is called as isthmus and it is circular construction. The uterine tubes or fallopian tubes are attached to the upper part of the body of uterus. The point of fusion between the uterine tube and the body is called the conus of uterus. Here you can see this is the body of uterus and this is the cervix. And this is the junction between body and the cervix and that is an area of constriction. It is called as isthmus. Here is the point of joining uterine tube with the body of uterus and that is called the conus of uterus. Further about the body of uterus. Above the imaginary horizontal line passing through the openings of uterine tube. Expanded dome-like end of the body is called fundus. The fundus is convex and covered by peritoneum. The body of uterus extends from the fundus to the isthmus and it contains the uterine cavity. It has anterior and posterior surface and lateral and left lateral borders. Right and left lateral borders. Here you can see again, this is the body and this is the cervix. Here is the isthmus. Then about the fundus. This is the conus on both sides or the area where the uterine tube joins with the body. That is area is called conus. So from here till here we can draw an imaginary line. The portion of the body that above this imaginary line is called fundus. This is the fundus. It is convex or dome shaped on all its surfaces and that is covered by peritoneum. The uterine cavity extends from the fundus to the isthmus. This space is called a uterine cavity and it has two surfaces, anterior and posterior, and two borders, right and left lateral. Coming to the anterior surface, it is flat. It is covered by peritoneum up to the isthmus, where it is reflected onto the upper surface of urinary bladder, forming the uterovesical pouch. You can see here, this is the anterior surface of uterus or body of uterus. It is flat. Then it is covered by a fold of peritoneum until the isthmus. Almost here is the isthmus. Until here it is covered by peritoneum. Here it is bent or it is reflected onto the superior surface of bladder. This is the bladder and this is the superior surface, creating a pouch or fold, and that is called a uterovesical pouch. About the posterior surface. This is the posterior surface that is also covered by peritoneum. You can see here, this is peritoneum on the posterior surface. It extends up to the downward up to an area called the fornix. This is the posterior fornix of vagina. This bend-like structure is or bend area is posterior fornix of vagina, which we will see later. So until here, covers the uterus, where it forms another pouch or fold called the recto-uterine pouch or pouch of Douglas. The two-fold anteriorly there is utero-vesical pouch or fold, and posteriorly there is recto-uterine pouch, which are anatomically important because it provides support to the uterus from anterior and posterior sides. This is the overview or summary of the discussion so far we have done. This is the anterior abdominal wall. Here you can see the names or labels. This is the back of pubis. And the third is the superior surface of bladder. This area, superior surface of bladder. This is the fourth labeled portion, utero-vesical pouch. In between anterior surface and the superior surface of bladder. And this is the uterus. And here you can see the posterior surface of uterus. And this is the posterior fornix of vagina. And here the sixth one is recto-uterine pouch or pouch of Douglas. And the seventh one is the rectum. About right and left lateral borders. Already we have seen the uterus has two borders, right lateral border and left lateral border. Each lateral border is rounded and is related to uterine artery. It is non-peritoneal because it provides attachment to the broad ligament of uterus. The uterine tube enters the uterus at the upper end of this border. Here, the round ligament of uterus is attached anterior inferior to the tube, and the ligament of ovary is attached posterior inferior to the tube. This is the right border and this is the left border. It is rounded in shape and it gives attachment to the broad ligament of uterus. Then on its upper end, this is the upper end on both sides, the uterine tube is attached or fallopian tube is attached. This is the fallopian tube and this is the attachment to the upper end of lateral borders. Inferior to the attachment of uterine tube, you can see ligament of ovary is attached. Inferior. And superiorly, you can see the round ligament is attached on both sides. That is about the upper part of uterus. Coming to the lower part of uterus, already we know the name is cervix. It is cylindrical in shape. Its lower part projects into the upper part of vagina. Thus, the cervix is divided into two parts, upper supravaginal part and the lower vaginal part. Once again, this is the dome-shaped part of the body and that is called a fundus. This is the real body of uterus and this is the isthmus, and below the isthmus we can see the cervix. And here you can see the dotted line. This is the vagina and this dotted line represents the projection of cervix into the vagina anatomically. So the cervix is divided into a vaginal part that is lower and a supravaginal part that is upper. Here you can see the further about the cervix. The cervix has an internal os, a canal and an external os. Os means opening. Internal opening and external opening. Internal opening communicate with the uterine cavity and external opening communicate with the vaginal cavity. About the normal position and axis of uterus. Normally, we say the uterus lie in the position of anteversion and anteflexion. What is anteversion? The long axis of cervix is normally bent forward on the long axis of vagina, forming an angle of about 90 degrees. This angle is called the angle of anteversion, and this position is called the anteversion, position of anteversion. Here you can see this is the cervix. We can draw an imaginary line forming a long axis of cervix. And through the vagina we can draw another imaginary line, and that is a long axis of vagina. There is an angle of 90 degree between these two long axes, and that is called angle of anteversion. And this is the normal position of uterus in the normal human body, and that is called the position of anteversion. About anteflexion. The long axis of body of uterus is bent forward at the level of isthmus, that is internal os, on the long axis of cervix, forming an angle of about 170 degree. This position is known as anteflexion. This is the body of uterus. If you draw an imaginary line through the body, and that is the long axis of body of uterus or long axis of uterus. And already we saw this is the long axis of cervix. Then there is an angle between, normally there is an angle present between the long axis of body of uterus and long axis of cervix, and that is called the angle of anteflexion. And this position of uterus is called the position of anteflexion. This bend is called anteflexion, and this bend is called the anteversion. So normally we say uterus is anteverted and anteflexed. Here you can see further about the normal position of uterus. This is the anteflexed, anteverted position of uterus. Already we saw anteriorly there is bladder and urethra, and posteriorly there is rectum, and inferiorly there is vagina. Remember this picture while discussing the relation. About the clinical relevance of abnormal positioning of uterus. Normally we say the uterus is anteflexed, anteverted. In some individual, this is not the position of uterus, or otherwise we will say there are common disposition for the uterus or abnormal positions of the uterus. They are named as excessively anteflexed, anteflexed and retroverted, retroflexed and retroverted. This abnormal arrangement do not cause any medical problem normally. Here you can see the normal position. This is the normal uterus, which is we call it as anteverted, anteflexed. Pink color all represent normal position. This is the excessively anteverted, the yellow color. This is the normal position. There is excessive bend, that is called the excessive anteversion. Here is the normal uterus, normal position, and when it is moved backward or positioned backward, that is called a retroverted, like this, retroverted uterus. Then when the body alone bend backward, and that is called a retroflexed position. This is the normal position of body. Instead of like this, it goes to the back or to the sacrum, and that is called a retroflexed. Retro means back. About cavity of the uterus. The cavity of the uterus is small because it has thick muscular wall. It is divided into two parts, cavity of body and cavity of cervix. About the cavity of body. It is also called the uterine cavity proper. It is triangular in shape. The apex is in continuous with the cervical canal through the internal os. From here till here is the cavity of the uterus. It has a uterine cavity and a cervical canal or cavity of cervix. About the upper portion, this is the cavity of body. This is the body and this is the cavity of body. The cavity of body is very thin or small because it has a thick muscular wall. This is the thick muscular wall. Because of this thick muscular wall, the cavity of body is thin, and we call this as a triangular in shape. You can see here that this is the apex of the triangle. This is continuous with, or this is in relation with the canal or cavity of cervix through the internal os, through an opening called the internal os. Coming to the cavity of cervix. It is otherwise called cervical canal. It is a spindle-shaped canal because it has a broader middle portion and narrow ends. It communicates anterior superiorly with the cavity of body of uterus through the internal os and inferiorly with the cavity of vagina through the external os. External os is otherwise called ostium uteri. You can see here, this is a cervical canal or cavity of cervix. Through internal os, it is related to cavity of body, and through the external os, it is related to or it is communicating to cavity of vagina downward or inferiorly. About relation of the uterus. It has anterior, posterior and lateral relation. The image we have seen already. Just to mention the structures. Anteriorly, the body of uterus is related to uterovesical pouch and superior surface of urinary bladder. The cervix is related to posterior surface of urinary bladder, the supravaginal portion of cervix. The vaginal portion of cervix is related to anterior fornix of vagina. Posteriorly, the body is related to recto-uterine pouch and sigmoid colon. The supravaginal portion of cervix is related to recto-uterine pouch and sigmoid colon as well. The vaginal portion is related to posterior fornix. Laterally, the body is related to broad ligament, uterine artery and uterine vein. The supravaginal portion related to ureter and uterine artery. The vaginal portion is related to lateral fornices of vagina. Anteriorly, the relation we will discuss the body of uterus and the cervix. The cervix we will see the relation supravaginal part relation and vaginal part relation. Posteriorly also the same way. The body relation, supravaginal cervix relation and vaginal cervix relation. Laterally also same way it is written. Then anteriorly we saw uterovesical pouch and superior surface. Posteriorly the supravaginal portion anteriorly posterior surface of urinary bladder. Vaginal portion to concern the fornix of vagina. Posteriorly you can see vaginal portion posterior fornix. Laterally we can see vaginal portion related to lateral fornices of vagina. Supravaginal portion posteriorly related to recto-uterine pouch. We saw already the pouch that sits behind the uterus and in between the rectum. That is called recto-uterine pouch. So both are related to this pouch. The vaginal portion, as we saw already, the posterior fornix. The lateral portion, already we saw, it is a broad ligament that is situated laterally on both sides, right side and left side. Also within the broad ligament there is uterine artery and a uterine vein. Supravaginal portion also has same relation, ureter and a uterine artery. Here you can see once again the relation, the anterior relation, the posterior relation and the inferior relation, and the lateral relation is not mentioned in this picture. This is the anterior uterovesical pouch and the bladder. This is the inferior vagina. This is the posterior relation, recto-uterine pouch and the rectum. This is the uterine artery. Here is the ureter and this is the cervix of uterus. Here is the attachment of ligament of ovary. Here is the attachment of ligament of uterus and this is the broad ligament. Coming to the ligaments of uterus. The ligaments of uterus are classified into two types, false and true. The differentiation between false ligament and true ligaments are asked in the examination. So, listen it. False ligaments are peritoneal fold. True ligaments are fibromuscular fold. The false ligament do not provide support. True ligament, as the name suggests, it provides support to the uterus. The false ligaments are 4 in number. The true ligaments are also 4 in number. But there is a difference. The false ligaments are broad ligament and recto-uterine fold. They are paired. But whereas the uterovesical fold and the rectovaginal fold are unpaired structures. All true ligaments are paired and they are round ligament, transverse cervical ligament, uterosacral ligament, and pubocervical ligaments. Further about ligaments in the form of supports. The uterus is kept in position and prevented from sagging down or coming down by a number of structures that provide support to it. These supports are divided into chief or primary and accessory or secondary supports. Coming to the primary support or chief support, they are muscular, visceral, and fibromuscular. The support of the uterus also is another question commonly asked in the examination. Muscular support are pelvic diaphragm, perineal body, and urogenital diaphragm. Visceral support are urinary bladder, vagina, and uterine axis. The fibromuscular support, they are the ligaments, the true ligaments, the transverse cervical, pubocervical, uterosacral, and round ligaments. In this picture, you can see the different ligaments. This is the round ligament, and this is the uterosacral ligament that connect between sacrum and the uterus. And here you can see the transverse cervical ligament that passes through the cervix transversely in the transverse direction. Here you can see pubocervical ligament attaching between symphysis pubis and the cervix. In this image you can see uterosacral ligament, transverse cervical ligament, pubocervical ligament, the urinary bladder in front and the rectum behind. This picture you must draw while asking or while answering the question support of the uterus. About the secondary support, it includes broad ligament, uterovesical fold, and rectovaginal fold. Here you can see the rectouterine pouch, which is nothing but rectovaginal pouch. Here you can see the uterovesical pouch, anterior support and the posterior support respectively. Here you can see the broad ligament attaching to the lateral border of uterus. This is the uterus. This is the lateral border. The broad ligament attaches to the lateral border, providing a huge support or acting as a huge support to the uterus. So far we have seen the gross anatomy. Now let us see the microscopic anatomy or the histological structure. The fundus and the body of the uterus is composed of three tissue layers: peritoneum, myometrium, and endometrium. The peritoneum is a double-layered membrane. It is otherwise called a perimetrium. The peritoneum that covers the fundus and the body of uterus is called a perimetrium. That is outermost layer. Then the middle layer is myometrium. It is a thick muscle layer. During pregnancy, this layer undergoes hypertrophy and hyperplasia to expel the fetus at birth. The innermost layer is the endometrium. It is the mucous membrane layer. This layer has again two parts, deep stratum and a superficial stratum. The deep stratum did not undergo much change during the menstrual cycle and it is not shed at menstruation. The superficial stratum undergo changes in response to estrogen and progesterone during menstrual cycle and it is shed during menstruation. These are the layers of uterine wall. Inner mucosal layer, that is endometrium, middle muscle layer, that is myometrium, and the outermost peritoneal membrane, that is perimetrium. Coming to the vascular supply and lymphatics, the uterus is supplied by uterine artery and ovarian artery. Mainly it is supplied by uterine artery and some portion is supplied by ovarian artery. You can see here. The venous drainage is into plexus situated in the broad ligament, which drain into uterine vein, or we can say the venous drainage is via uterine vein. The lymphatic drainage is into iliac, sacral, aortic, and inguinal lymph nodes. About the clinical correlation, there is a procedure called hysterectomy. That is nothing but surgical removal of uterus in case of cervical and uterine cancer. While performing hysterectomy, a good knowledge of regional anatomy and its blood supply is important to prevent bleeding and damage to the surrounding structures. About its innervation, It has sympathetic fibers and parasympathetic fibers. Sympathetic fibers of the uterus is different from that of cervix. The sympathetic fibers of uterus is from uterovaginal plexus. The parasympathetic fibers of uterus is from pelvic splanchnic nerve. The cervix, it is from inferior nerve of uterovaginal plexus, and the afferent fibers are through inferior hypogastric plexus. About some of the conditions of uterine cavity: endometriosis, fibroids, and endometrial carcinoma as mentioned here. Endometriosis is the presence of ectopic endometrial tissue at sites outside the uterus. We have seen already endometrium is the inner mucous membrane layer of the uterine cavity that is supposed to be present only in uterine cavity. When it is present any other site other than uterine cavity is called endometriosis. The presence of endometrium or presence of any tissue other than its normal position is called ectopic or ectopic presence of that tissue. So when the endometrium is present other than the uterine cavity, that is called endometriosis. Fibroids are benign tumors present in the myometrium. Endometrial carcinoma, it is the most common carcinoma or malignancy of the female genital tract, most commonly found during or after menopause, characterized by heavy uterine bleeding. That is all about the microscopic and the macroscopic structure of uterus. Thanks for your patient listening and watching. Please subscribe and share with your friends.